So the goal of this interview is to get, a real-time feel for what it is like for a physician, for a surgeon, to start a business. Oftentimes, when we study people who have succeeded, we come at the end of the line after they have already built an empire, and then we try to work back and see, how did they do it. But I think it's valuable to, talk to someone who is actually doing it right now and see, what are the struggles, what is it like, and, so that people, medical students, doctors, surgeons can also learn and see if this is something that they want to pursue. So the first question though is why, why does a surgeon, because usually a plastic surgeon is likely to be financially comfortable. They probably have a fulfilling job. Why would they choose entrepreneurship?
It's a great question. I think for me, if someone had told me 5 years ago that I'd be doing what I'm doing with regards to entrepreneurship, I probably wouldn't have believed it. I think I fell into it. I think, entrepreneurship sort of happened to me. And I think if I really am honest about how it happened, which helps to answer the why, I think a lot of the same traits that made medicine and plastic surgery attractive to me are the exact same qualities that have served me well as an entrepreneur. Long nights, rewards that aren't really obvious at the moment, and having to sort of wait. There's no instant gratification. You're sort of planting a seed and waiting for things to grow. And I think for me, the last piece of the puzzle would have to be being somebody who wears many hats. So yes, I'm a surgeon. Yes, I'm an entrepreneur, but I'm also a mother. And I think that last piece, being able to sort of balance and juggle many demands, has been a challenge, but one that I really enjoy. And I think once I started, learning about entrepreneurship and gaining some traction with my small business, I love the idea of myself creating a next generation or a new generation of entrepreneurs and entrepreneurship. I love the idea of my children's names being on my brand so that they too can feel the pride that other legacies and other families feel when they walk by, whether it's Rockefellers, whether it's Calvin Klein, whether it's any of those sorts of institutions. So I think the interesting answer when people ask me why is I say, why not? Why not Blair+Jack? Why not my family? Why not my idea? I think a lot of times you get very nervous about the what ifs and what if I fail and what if this is shunned or laughed at. But my way of thinking is why not? And I think the why not, as I mentioned before, is what got me here. I never sort of limited myself by what others had thought. So I could have played it safe at many different life stages, but that taking a bit of a risk and trying something a little bit different, I think, is what has served me well in medical pursuits and now within this.
Yeah, that's a good perspective, a fresh perspective.
Mm-hmm.
I actually take that why not perspective in other areas of my life. That's not academics, because lots of people ask the question, why me? And I often ask, why not me?
Exactly.
So it's a good thing. And I like that you talked about how, the life of a surgeon has a lot of similarities with the life of an entrepreneur. And I know that you have leadership experience. You're like the chief of plastic surgery at your hospital.
Yes.
Yeah.
That's correct.
So perhaps you can talk about, what are the differences though? Because I feel like in a hospital, there's already a subconscious understanding of the hierarchy in the OR. There's a subconscious understanding of who is at what position. How is leadership in your profession different from leadership, when you're innovating, when you're an entrepreneur, when you're trying to sell a product? How are they different?
Well, I don't think anybody's ever asked me this question. That's a great one. I think the differences would be Largely due to the fact that entrepreneurship is uncharted. There's no roadmap. There's no algorithm where you sort of have, arrows pointing to, the hierarchy. This person reports to that person, reports to this person. And I think part of it too is when you're still building a team, you end up wearing many hats. So I can't tell you how many times I've gone to work, focused on my job, focused on the surgery, focused during a meeting, and then run out to fulfill some orders from the site. Because when you're still building a team, especially during a pandemic, you don't really have the luxury of having a lot of resources when it comes to personnel. And so I was and still am to a large degree, the CFO, the CMO. I'm IT, I'm customer support, all those different roles. So I think that's yes, you sort of balance different demands as a physician, and you sort of wear different hats, and to a certain degree. But with being an entrepreneur, you really everything is so nebulous and up in the air. So one day I'm the graphic designer choosing colors for packaging. So there's really a lot of room for redefinition. So you go into it thinking one thing, like, okay, well, I'll bring my medical expertise, but then it's like, well, but I don't really have someone to build a website for me right now, because my usual networks I can't tap into, because when we sort of softly launched, we were still in the first couple of weeks of the pandemic. But again, you sort of dig deep, and I did build our very first website. So I had to learn sort of the back end of coding and ensuring image would come up looking the right way on your website, and things that I just never, again, you couldn't have told me I would tap into this skill set. But I mean, many of us surgeons are indeed, we enjoy art, or art comes into play. So I guess it's not so far of a stretch. But again, I mean, you couldn't have told me I'd build a site, I would be so involved in design, I would just have so many hands-on experiences on the back end of things. But I think for me, I love the idea that I can tell you the entire story from start to finish. I can tell you about the issues with supply chain and getting our packaging and having to sterilize my own packaging because I knew how to sort of make our first set of samples. And so the sort of grit it took to sort of start this thing from scratch, I think, is something I'm very proud of, and it motivates me. And I think one thing that I found very interesting along the journey is journaling. I'm not someone who sort of has, time to kind of reflect a lot on the past and whatnot, but someone gave me that idea, and it's been fascinating writing about the highs and lows, because in many ways this journey feels kind of like reality TV, completely unscripted. You think things will go one way, they go left, they go sideways, you rebound, you start over again. And so, once in a while I'll go back and read through the struggles initially, where my packaging, I could trace it as far as Vancouver, and then it disappeared. And, people are making requests, and the media is asking for samples, and I'm having this kind of troubleshoot with my husband at my side. And so it's just so interesting and funny and enlightening to kind of look back at those days and to see how far we've come in this journey.
Yeah. Two things I want to talk about that you mentioned. First, you talked about building a team. Second, you talked about, you said entrepreneurship happened to you. But let's start with that. When you say entrepreneurship happened to you, what do you mean? Because, when the person identifies the problem, you find the problem, you think that this is a real problem. There are often different ways a person can go about it. A person can become an activist and, make a lot of noise, pressure society, pressure the government, pressure to change that problem. A person
Mm-hmm.
can choose to work within the establishment, rise within their career, rise within their profession till they reach a point where they can make decisions that would solve that problem. But
Mm-hmm.
another person can choose to solve that problem by innovating as an entrepreneur. So tell me
Mm-hmm.
what you mean when you say that entrepreneurship happened to you.
I think what I mean by that is I already was wearing so many different hats that there are many things that come up as questions, clinical questions, things that patients ask me at work all the time where I say, that'd be interesting to look into one day, but that one day won't be for a very long time. There's so many ideas that get put on the back burner. And I think I'm in the company of, other physicians who, aside from not having the time, sometimes we sort of say, oh, I'm sure someone else is working on that. And so you sort of have the idea, but gosh, what would it really take to do this and to do it at a level that you would be comfortable with? And so you have this very long to-do list, and it's very easy for that list to sort of keep getting pushed down with new things being added to it. The interesting thing is I was chatting with my sister actually, who is I'm one of 5 children and she's the eldest, and she actually studies entrepreneurship, especially among minority communities, and we had a very interesting conversation. I think a childhood spent outside of Canada was very interesting in hindsight. And the reason why I bring that up is because I was born in Montreal, but then my family moved to Nigeria, where my family is from. We lived there from when I was age 1 to age 8. And I think people say, oh, you were so young when you left. Do you remember anything? And I think by the time you're 8, you do have some decent memories. It's hard to really forget things. And one very interesting memory as a child is my mother, who worked at a university on the weekends, would help provide catering for events. And so that was, I joke around with her and I say, wow, Mom, you had a side hustle back in the day. And she says, oh, yeah. And, she had this network of women where everybody had a 9 to 5, but a lot of people also had this sort of, the kids are in bed like 8 to 10 p.m. Shift where they would dedicate their skills and talents to other pursuits. And so, it's almost like subconsciously it was in the back of my head that that's just something you do. You find something that you have an interest in and you pursue it with the same sort of vigor as you do your day job. I think the pandemic, as horrible as it was for a lot of people, created a very fascinating environment for me to really just prosper as an entrepreneur. And I think one of the greatest resources I had was time. In the first couple of waves when my hospital, like many others, really had no work for surgeons, especially those like myself who do elective work, all of a sudden I had free time, something I hadn't had in years. And I really wanted to find ways to capitalize on that. And that's how things really got moving. Having time to sit on the phone on hold, listening to elevator music while talking to Health Canada about regulations and rules, speaking with my legal team, talking to the packaging folks, and then just doing my own official and unofficial research, whether it was just Google searches or whatnot, to learn, listening to webinars, attending podcasts, and just really learning the back end of entrepreneurship was really important to me. And I think also, the societal shift is one that I can't ignore. I think the changes that happened in many industries when it came to really recognizing the important contributions of people of color that sort of coincided with the pandemic, I think was very important. All of a sudden you have massive corporations like Sephora within the beauty world and beyond really making efforts and pledges after George Floyd's death to really give a voice and give resources to people of color like myself. I think that really propelled a lot of us into action and saying, why not us? There are all these blank spaces when it comes to products and ideas, and it's high time that we are recognized as contributors to all of these different fields.
Yeah. The next question I want to ask you, because you briefly touched on it, you talked about, coordinating with different people. It takes a lot of people to build any product, to ship any product. And so tell me about the process of building a team, because you identify a problem, you need to go about finding talent that will solve your problem. In my industry, I have a chatbot, like we talked about last time. I'm solving a novel problem. I'm building a new product, and I'm sort of doing this. I know this person is talented, but I know that what I'm trying to solve is something that hasn't been done yet, and that they're not likely to encounter problems that they haven't encountered before. And even though they are confident in their abilities, a month down the line, 2 months down the line, when they're encountering these new problems, they might not be able to, to solve it. And so I wonder if that's the same problem, because I think your product is pharmaceutical, right? Yeah. So how did you go about finding, the right people, and how did you choose them?
Great question. So, my skincare line is dedicated to men, focusing first on men with shaving bumps. And so my husband asked me for help with his. And that's when I got to work on trying to find a solution, because we went through drug marts, we went online and found really few options. So the first part of answering your question is that your own network often has the expertise that you, like when you sort of look back, you say, oh, yeah, of course I should have called person A and B. In my case, the very first person I reached out to was a pharmacist. So she and I had worked together right from my first year in practice. So, 10 years ago, where I would go to her and say, hey, I did a surgery, this person's scar is a little bit thicker, and they find this very itchy. What can we mix that they can massage in to make things better? And I loved her approach, because she would often refer to the literature, review it, come back to me and say, hey, I read about this combination, it's new, they're using it in Europe, what do you think, should we try it? Let's talk to the patient. And so I had a eureka moment where I thought, oh, of course I should call this person. So tapping into one's own network, I think, is crucial. The second piece, based on what you shared with your experience, is enthusiasm. You need people who are excited about what you're doing and what your goals are as you are. Because the road is bumpy, lots of wins, lots of losses. And you really want folks who, even on the worst days, where things just look like, you're about to wrap it up, and give up, you need folks who keep saying, no, we have to keep forging ahead, let's keep pushing forward. So I think also when you're started, it's hard to really spread yourself out. What does that mean? Like diluting the enthusiasm within the team. And so for me, what's worked is just really figuring out who are the key players who I need on this team. So if you have a wonderful product but nobody knows about it, that's a challenge. So you need the right marketing people who can really distill your ideas down and help you shape and craft your mission, your values in a way that people can digest and understand. Because sometimes, and I found this out early, is I, as a physician who did some research while in residency, I can talk to a medical audience, I can present data to a medical audience, but some people who I want to reach with my product are people who get their advice about their skin from TikTok and Instagram. So, there's sort of for me, there was a need to sort of understand how to shift and how to transform the message so that people can hear. Because you can have a wonderful idea, but if people who you want to reach aren't at the right platforms, then you're not going to get very far. And then B, if you're trying to talk to everybody, then you actually talk to nobody. So it's really important to sort of, in your messaging, work on having someone on the team who's able to help with that. And so, those are the main sort of players that I wanted. I knew that with having a skincare product that would have formulas that were sort of unique to myself and my team, with regulations that govern how to distribute them, I knew having legal advice was crucial. So I said, okay, let me find someone who can help. And I had another contact who referred me to a wonderful team. And it was important to find somebody who knew about regulations when it comes to skincare products in Canada and the US. And so it was a very specific team and individual. So it's really important to find, if you're trying to create a niche product, then your team has to sort of be handpicked to sort of reflect that. You can't have someone who, yes, is a lawyer, but does sort of commercial real estate, trying to give advice about something so specific. And so we started with that. And what I'm realizing is that networks beget networks. So you speak with somebody and they say, oh, you know what? Yes, I'm happy you chatted with me, but you know who you should really meet is my colleague X. And all of a sudden now you're being exposed to people who are a little bit, far removed from your immediate network, but who are very helpful in terms of really helping you build your product and gain traction.
So have you had to build a relationship with someone, whether an employee or just a business relationship, and had to cut it off? And how did you let that go?
Good question. So you know what? Yes, that happened earlier on. It was something that dealt with our packaging, where we had given a contract to a team, and it became obvious early that they wouldn't be able to meet our standards. And that was something that was dictated by the graphic designer. We were getting samples after months and months of going back on the nuances of color and shade and font. We would get stuff that just was so far off the mark. The lessons I learned from letting go of that team were that contracts are crucial, and you really have to spell things out. And contracts really come into play, not when everything is going well, but when everything has gone wrong, or you need to sort of cut people loose from the team. So, again, it's part of the process. You certainly win some and you lose some. We lost on that one. But I think overall we were better for it. We got what we wanted in the end in terms of working with a new team. And then you sort of learn how to ask questions. I think when you have an idea and it's very obvious to others that it's a great idea, you get a lot of people who feign interest. And you have to be able to decipher if the interest is in you and your success, or if it's in them and their success. Yes, we all want to win. We all want to have a good situation. But unfortunately, you really have to separate people who aren't really looking out for the best interest of you and your business from those who are more genuine.
Can you talk a little bit about how you've driven exposure? You've got lots of articles written about your product, about you, about your family. Even with BFN, that was another method of exposure. Can you talk about, what is it that you do differently that gets people to cover, papers to cover your story?
Well, we've been very lucky. It's humbly very, very just appreciative of the support from the BFN and the BFN's networks and various communities. I think our story is one that resonates with people. And I think that's what a lot of novel ideas boil down to, is the story. I think people love the idea that Blair+Jack, my company, was created out of a desire to help a loved one. Everybody has someone who they love or care about who may have an issue, and you sort of go above and beyond to find solutions or think outside the box to help them. So I think people can relate to that scenario and situation. And then people, I think, also can understand how I do a lot of work with women. I do breast cancer reconstruction, skin cancer reconstruction, and how I used the skills and knowledge from that area of my work to now sort of focus on helping men with issues. So I think overall, I think people like situations they can relate to. And I think that's really, really helped us out. And I think when building our team, I was very fortunate to have been linked up with Ashley McIntyre, who runs her own agency in Toronto. And she was able to really, again, it's all about networking, tap into her networks when it came to the media and say, hey, I have this plastic surgeon who's created a skincare line. Here are some samples. Would you like to speak with her? And thankfully for us, we had a lot of yeses. People who said, oh, yeah, sure, we'd love to hear more or learn more. And, that's how the momentum has built for us. And we really hope to keep on building into the new year and beyond.
Yeah. That's great. That's like something, that's the media coverage is like fuel to any business.
Absolutely.
Yeah. So there's this thing about full-time founders. You have a full-time career and you're still pursuing business as an entrepreneur. There are lots of investors that usually don't think a business is serious unless the founders are full-time. Have you encountered this, and how have you coped with that?
Oh, great question. So, no one has said that to me explicitly. I'm sure some must have considered it. But I think, the work speaks for itself. I'm just one of those. Thankfully, being a surgeon, sleep is not a priority for me. But I say that only half joking. Sleep is very important. And so is self-care. Generally speaking, I think once you can show them the assets. So what does that mean? So for example, for my skincare line, I showed them everything. This is how I went about obtaining barcodes, UPC codes for each of the products. So all those sort of little things that I do in the wee hours, looking up online, things that I've just never, I have no idea how to do any of these things. But I call one person who lets me with one person who takes me to a website. And so a lot of learning on the job. So when you come to a meeting and you say, hey, here is my pitch deck. Here are some samples, which means I don't just have an idea for a product, but I already have it. It's already been tested. Here's the lab that tested it with the reports. Here are some articles about what we're doing. I think all those different sort of deliverable items make it hard for someone to say, well, I'm not sure if you're dedicated enough to this pursuit. So when you come with, all those various, assets to show, it speaks for itself, because those who know that you don't just stumble upon these things. Take time, months and months, often years to develop. So I think the insiders can appreciate that.
Right. And the last big question I want to ask you is about how you manage your time. I think you've touched on it a little bit. You work, especially after COVID, because I really understand what happened during COVID. You were at home, you had more time on your hands, but now you work full time. During the day, you still have to run out to make calls, and at the end of the day, you still work again. So it's not like it's integrated into your day. It's not like discrete time you set apart to work on your startup.
Oh, yeah, totally integrated. So, I think being on top of things and just really working to be organized. I can't say I'm 100% organized, but I'm still working on it. But yeah, I know which days I'm more free compared to others. So, and I make it kind of clear to people who I'm working with. So I say things like, if you try to call me on a Tuesday, which is my OR day, you will not reach me. Because at the end of the day, I'm still while I'm in the OR, I cannot afford to not have my 100% focus on a patient who's put their trust in me. So it's really cool to be able to kind of, focus. And then once I'm done, once I've scrubbed out of my last case, then, hey, we can talk. But, I do have a schedule that I created early in my career to have some flexibility. So what does that mean? I try and really jam-pack my meetings, let's say on a Monday, which is my administrative day, where I know, I'm not, in the OR, I'm not usually on call. I just have time to really fit in meetings. I think it helps now that we've moved towards virtual meetings. So gone are the days of, I have to drive in to person X to meet with them. No, we just, schedule Zoom meetings, we schedule Google Meets, and so that really helps a lot. It takes, me off the road, and I can really focus on just getting the message out there, asking the right questions, and then, having an action plan.
Right. Those are the big questions I had for you. I think people will benefit from hearing your story. I think it's really, really inspiring how, you started this idea because of your husband's, bumps on his face. I think it's already inspiring that you come from a family, like you have like 3 surgeons or 4 in your family. So maybe tell us a little bit about yourself and your story and how you came to where you are right now.
Oh, sure. So, surgery became the family business, so to speak. So my father is a general surgeon, and he trained very adventurous and brave. Left Nigeria after medical school to come to complete his residency at McGill University. And that's the reason why I was born in Montreal along with one of my brothers. And so we then moved back to Nigeria because my parents, my mom was an educator, their goal was to make Nigeria healthier and better educated, and the plan was to stay there indefinitely. And then during the 80s, they chose to move us back. The plan being we would leave for a while because Nigeria was becoming less stable. And my father felt that, it was unfortunate that he couldn't guarantee that his children would have the same university education that he did, based on seeing what he was seeing at the university where he was working, with strikes and universities being closed for months on end. So then he, again, being adventurous, chose to move us back to Canada. Now this time, not to Montreal, but to Northern Ontario. And so we moved up to a small town called Kapuskasing, which is 10 hours north of Toronto, really far in rural northeastern Ontario. And we got there August of 87 and looked around and thought, wow, this is a big change, to come from Ilori, big city, to a small town. Nigeria full of Nigerians. We were the 7 Nigerians in town in my family. The weather, of course, goes without saying. That first winter was a real shock to the system. But it was also a wonderful experience in that everybody there, they knew this was such a new experience for these 5 kids and their parents. And so when you're living in a small town where people don't lock their doors and really take everybody in, we really had a wonderful, warm reception from the town. And so I was there through elementary school, I was there through high school. From there, my siblings and I all went away to school. I ended up being selected to go to Yale for my undergraduate, which was a very big deal coming from a small town that really didn't have any of these sort of advanced placement programs in high school and things of that sort. And at Yale, I did well. I didn't struggle in spite of not being from one of the bigger schools that was a feeder school, so to speak. After Yale, I went to Columbia University. I did my master's in public health. It was an interesting time to be doing that during 9/11. My parents promptly told me to come back home. I did. I came back to the University of Ottawa for medical school, McMaster for plastic surgery residency, and then went back to the U.S. Briefly for a year to do my fellowship at Harvard, before then coming to set up my practice in Newmarket. I have three brothers. One is an orthopedic surgeon and the incoming chief and president of the Canadian Orthopedic Association, and he's a chief of ortho at McMaster. He works at the Children's Hospital. And my two younger brothers are also plastic surgeons, both of whom I work with. One who works primarily at Humber, his name is Buki, and one Modi who works with me at Southlake. And then our sister, as I mentioned earlier, is the one who did the MBA and studies entrepreneurship, and she lives out in Calgary. So it's been an interesting life, I can say that for sure. And I love talking about our experiences, because I love the diversity that exists within diversity, if that makes sense. Because what are the odds that a girl from Ilori grew up in Kapuskasing, went on to become a plastic surgeon in Newmarket. The whole thing is just, sometimes even I laugh at how unique the story is, but I also know that it's a blessing. I've been very blessed, and I have people who are in my corner, always rooting, always cheering. And, sometimes you hear people say things like, oh, it must be so hard to be a female surgeon in a very male-dominated, often white, male-dominated field. But when you come from a family where you have a father and three brothers who are surgeons who told me throughout, like, oh yeah, there's absolutely no reason why you can't do this, you believe them. And so you kind of go into experiences where nobody looks like you, with the confidence and the weightlessness of someone who has been told that, yeah, you deserve to be here, you belong here.
All right. It's been really, really great talking to you. Thank you. Thank you for taking the time.
Thank you. This was wonderful. You asked me some questions that really made me think.